Let's watch some clips of Bernie Sanders questioning a Trump nominee, specifically Russ Vought, his pick for the Office of Management and Budget for Medicaid, where some rather stunning revelations can be made in a rather short amount of time. Hey you, yes, you, we now have a Substack website where you can help support the channel. For just $8 a month, you can get daily articles exposing the chaos in Trump's first 100 days, a weekly podcast, and other exclusive perks, all while helping the channel grow and defend democracy. This is something that's not just very important to me, but enables us to get our message out to the most amount of people while also being just a genuine passion that I would love to pursue. So for those who have been wondering how to support the channel, how to help us grow, you can sign up now at the first link in our description. Thank you, and let's get back to the video.
It's the vote. We are living in a moment in American history where at a time when 60% of our people are living paycheck to paycheck, we have more income and wealth inequality than we've ever had. Three multi-billionaires own more wealth than the bottom half of American society. People are struggling to put food on the table. Very rich are getting much richer. We have heard from our Republican colleagues in the House that they think it is a good idea to go forward to provide massive tax breaks to the billionaire class and at the same time help pay for that by cutting back on Medicaid. And I know that you are more than aware that Medicaid not only provides health care to tens of millions of lower income people, but 2 out of 3 people in nursing homes in America, elderly people, are on Medicaid.
I just wanted to stop here to further put in perspective what Bernie is saying real quick. We're told we have to cut things like Medicare and Medicaid. They're too costly. We can't afford universal health care because we need to afford things like more handouts to billionaires and corporations. So we have to cut spending to be able to afford that, despite 3 billionaires owning more wealth than half the country. The top 10% owning 80% of the country's wealth, all while carrying less than 50% of the tax load. Meanwhile, corporations are hitting record profits. Stock buybacks for rich shareholders are at an all-time high, yet wages stay stagnant. Republicans are still pretending we have to cut Medicare, Social Security, and Medicaid. I mean, Trump's treasury pick is saying he's against raising minimum wage. Now, let's see what the Party of Workers pick for Medicaid budgeting has to say about healthcare, specifically the healthcare that the most vulnerable portion of our population relies on.
Will you tell the president that it is immoral, that it is wrong to cut Medicaid, cut healthcare for low-income Americans, for children, and for the elderly, and give tax breaks to the very richest people in our society? Is that something we can count on you to do?
Senator, one of the problems, and I appreciate the questions, one of the problems that we have in the Medicaid problem is the extent to which, instead of being a program for the poor, it's alone, and the extent to which it's meant for nursing homes and things of that nature. We have able-bodied working adults on the program.
You're going into another area, and that is a healthcare system in general. As you well know, unfortunately, the United States of America is the only major country on earth not to guarantee health care to all people as a human right.
No, that's not an issue at all. These people just say things that they think sound good and they hope people won't think it through at all. Increasing the pool of people with those who incur less risk, who will be less costly, only then further evens out the costs among those within the pool. The only people working who have Medicaid are those who require services they depend on Medicaid for to work, or if they have income below the eligibility level. So to put in perspective what this man is saying, the problem is that low-income people or those who require some sort of medical aid are allowed Medicaid. He would rather the low-income people, those who need medical assistance or something to work, to get off the guaranteed insurance and to have to fend for themselves with private insurances that will be more costly and then may or may not even cover the procedures needed to the same effect, at least incurring them more out-of-pocket costs. Because to this guy, healthcare is a business. It's something to profit off of, and that needs justified by the cost, not something to ensure that people have access to.
Will you try to determine how it is that countries around the world are able to provide care to all of their people, and in some cases spend 50% per capita of what we're spending? Do you think the function of the American healthcare system should be to make huge profits for the insurance companies and the drug companies, Or do you think maybe we should have a system that guarantees health care to all people as a human right? Do you believe that health care is a human right?
Senator, I believe that it's very, very important that we put the healthcare dollars that the taxpayers are covering for the healthcare system, which you just mentioned is substantial, and to make sure we have the best outcomes in those programs.
So the healthcare system, in my view, is broken, it's dysfunctional. But my question to you, it's a simple one, as an advisor to the president. Do you think we should join every other major country on earth and say, you know what? Whether you're poor, you're rich, you're young, you're old, healthcare is a human right. We are the richest country in the history of the world. Do you think we should do what every other major country on earth does?
Senator, I think it's important to provide legitimate, evidence-based outcomes for people within the healthcare system.
I don't care if you're poor, you're rich, you're old, you're young. Healthcare is a human right. Yes, no.
Senator, I think the president has not made he ran on providing good healthcare outcomes. That's my view.
He can't answer because no, they do not think that. They don't think anything close to that. These people think healthcare is a business that has to justify itself with cost versus profit analysis rather than being a human right and something that should be a core function of any government to provide its people, which, as Bernie is pointing out, is the norm in every other developed country in the world. We are, like with most things, behind the curve of the world on this. And it's because we're allowing billionaires to hold us back in the name of their own profits. We pay more than other countries because of administrative costs mainly. The cost to have all these different private insurers, we operate at an administrative cost that is 8 to 16 times higher than that of other countries. We also have less leverage when negotiating for medicines. Having all these private insurers rather than the government negotiating gives big pharma this kind of monopolized power when negotiating costs, which allows them to raise prices consistently because they have all the leverage. This is why many of the same medicines and same treatments are more expensive here than they are in other countries. The quicker we start realizing the marketplace doesn't belong in things that are a necessity to live, the quicker we can start getting back to focusing on innovation and the American dream.